And then we have no choice but to recruit the accessory muscles of respiration. And that causes a ripple effect that not only inhibits the abdominal wall, but also overactivates scalenes, upper traps, levators, affects scapular rhythm, affects hip extension, affects core stability. Finally, if we think about the programs for movement, we have to think about gait, our primary movement, and single stance, and that's why single leg work is so crucial. Most of sport is not in double stance. Most of sport is weight transfer. It's in single stance. So we can't ignore single stance. We look at it from a balance standpoint, for reflex purposes, also for a strength standpoint and coordination standpoint. Chris Powers is going to talk about the coordination between the hip and the knee and the problems that ensue with medial collapse. So the single leg squat, and then more provocative procedures like hopping and jumping would fit into that paradigm. So I'm always looking at those three windows into performance, into capacity, to look for control. If we talk first about the diaphragm and the core, we know from Professor McGill's model about the 360-degree control that's required. The muscles all have to work together to create tension so that we have an enhancement in stability. It's not just one muscle. If we think about the diaphragm and the pelvic floor, they're creating intra-abdominal pressure with the abdominal wall, with the spinal intrinsics. Most people, however, have this poor form. They have the scissors position and an oblique diaphragm. We want to centrate in the horizontal plane. In fact, neurodevelopmentally, kinesiologically, as the child develops, this is something that naturally occurs, is the achievement of a horizontal position of the diaphragm. We want to test that. We want to ensure it's there. We want to see how resilient and robust it is. A recent paper in the Journal of Orthopedics and Sports Physical Therapy just a couple months ago concluded that patients with chronic back pain appeared to have both an abnormal position and a steeper slope of their diaphragm, so it looks like this. So if they're doing weight training with you, and you're only provoking a more intense reaction, if you're firing and wiring and sealing via myelination, the reinforcement of that pattern, then that's going to be a breeding ground for dysfunction and eventually for injury. In DNS, the Dynamic Neuromuscular Stabilization School of Thought from Prague, one of the first things that they teach is how to centrate the diaphragm in the horizontal plane. They go over how it's something that naturally occurs in the infant after 4 months of life, and it's something that there are different strategies in order to facilitate it, and we want to be aware of those strategies as much as possible. So here's a sedentary person, scissors in the back. We're looking at a test, which is a squat on the back. It's the landmark position of achievement for a baby at 4 months of life. By 4 months of life, triple flexion is accomplished. But unfortunately, what we often see as we go through life is that we lose this motor control, primarily through poor posture and poor breathing habits. When we test people, it's important that we don't over-cue. Professor Yonda said during movement pattern testing, minimal verbal cues should be used, which test an individual's habitual way of performing movement. If the cues are too leading, then the test will be of the subject's ability to learn how to perform the movement correctly, rather than how they habitually move. And this permeates McGill's work, it permeates Gray Cook's work. It's one of our guiding principles. We see from Professor McGill in the second quote, people are graded on how they choose to perform rather than how they could perform the tasks, given feedback or coaching. The coaching will come later. In the testing, we want to know what they do when they're left to their own devices. We want to see how corrupted their motor program is, how much work we're going to have to do. Sometimes you can cue a person and they correct, that's a good sign. But we're going to start by looking at uncued. Gray Cook says the hallmark of the SFMA design is the use of simple basic movements to expose natural reactions and responses by the athlete, by the patient. So we know we want to enhance performance, and we want to enhance it not just consciously, when they're under our guidance. But we want to change the engram for movement so that we know it's resilient and it's going to be there under stress. It's going to be there when they're under fatigue. It's going to be there when they're facing an unexpected perturbation, like a basketball player landing on somebody else's foot that they didn't expect to be there. But we're going to start in this position. Then we set the lower quarter. So I'm kneeling. Chin is in. I don't want to go into scissors. I'm not going to go into kyphosis. It's going to be neutral. I'm just going to rest. Then I'm going to set here without changing my spine position. I'm only going to push up a little bit. I just want to get serratus to fire. I want to stabilize scap thoracic. We want to stabilize all the links in the kinetic chain. We don't want to just work one area in isolation. It's a whole body exercise. So chin is packed, getting that ST closed chain function here, but we don't want to pike. We're not going to push off too much. So there's the ST, and now we start with this, and then we can start to roll. Please don't ask me to do too much, okay? But that'll provoke the scissors in somebody that you feel is, let's say, a basketball player, fourth quarter, they start to break down, they start to go into anterior pelvic tilt, boxing out or something like that. You want to take it to that next level. When we start to do these things, the other thing that can happen is we can start to see that effect that we talked about yesterday, where the pelvis shouldn't become unstable, like a canoe in water. Obviously, you don't have power. You can't shoot a cannon from a canoe. We don't want to allow a person to do these things with the pelvis moving around. That has to be locked down. We need a punctum fixum. So we're moving at the ball and socket joint here, and we're training the spine as a punctum fixum. The punctum mobilum is the ball and socket joint. The punctum fixum is the core, the rib cage, the oblique abdominal wall. The inter-abdominal pressure that's produced by the diaphragm pushing down into the pelvic floor. And then we've got the punctum mobilum here. So these are crucial things. This helps build stability. When we can keep that spine stiff and stable, then we can create a lot of power and have that trampoline effect from our pulsed actions. But if we can't control the rotation, we can't control the transverse plane, then it's the end of the athleticism. The transverse plane, the diagonal movements, those are the most important movements of all in sport. All of our sports have that. And when we start to get into all this twisting motion, we not only lose the ability to convert the energy from the big muscles in the lower quarter that we build up with our single leg activities, but we also create a breeding ground for spinal injury, which is an epidemic, and things like oblique strains, groin injuries, etc. So Taloff press is another excellent exercise. Also works, of course, chest press, but in a functional way. You're never going to be able to generate the load here that you can generate on a bench, yet this is more functional. When we add an equilibrium challenge, such as doing this upright or even doing it on one leg, now we're activating more stabilizers and more core. And in fact, when we start to do our chest press from an athletic position, where there's all this load here because we're being pulled this way by the pulley, and I'm having to stay in that athletic position, I'm going to feel, more than anything else, my obliques. In fact, the obliques are going to start to light up quickly. So we might have a person walk out, do some chest presses, hold one. So we might just do like 3 reps and then hold for like 10 seconds. If that's a piece of cake for the person, and we're asking, you feeling your arm or are you feeling your core? They say they're feeling their core. This is an ideal exercise for a back pain patient who we feel has sensitivity to rotation, which is anybody with a disc. Because the annulus, when a person bends and twists, it opens up like a Chinese finger toy so that the nucleus can squirt through. And drop by drop, they get that nuclear leakage. They get not just a mechanical radiculitis, but a chemical radiculitis. So we got to knit it together, get them to control that rotation so they can have a long baseball career as a powerful hitter. And we know how often the baseball players get hurt by discs. Same with our golfers. But it's also for being able to generate power. It's also for our shoulder patients. Because the shoulder patient, the key is going to be getting the core to do its part. Because we know that when somebody throws, most of the power doesn't come from the arm. Most of the power comes from below up. Less than 10% of the power in a pitcher's arm is generated from the arm muscles. They did the studies in the late 60s at USC, Jacqueline Perry, looking at Sandy Koufax and Don Drysdale, and from that point forward, it opened everybody's eyes to how the arm works, how throwing works. It's a release of the energy. So we want an exercise where our patient who's got an empty can sign or has the labrum stretched out, we want an exercise that they might feel in their arm, but get them to feel their core instead. So, are you feeling your arm? No. How's your arm feel? Fine. Are you feeling your core? Great. We do a pre-post empty can. The empty can is going to become non-painful, and it's going to become instantly stronger. So the Pallob is great for so many different applications. Similarly, the chop. We'll do chops with our rotator cuff patients or our disc patients. Again, they're going to feel their core. They're not going to feel their arm. And then when we go back to other arm tests, they're going to feel stronger. We had, as we know yesterday from the first talk, the principle of arthrogenic inhibition. Arthrogenic inhibition is a reflex arc. It's a neurological situation. If you want to reset, create a punctum fixum. When you're working the brain instead of the periphery, when you're working functionally and integratedly, following a developmental sequence that's holographically stored in the central nervous system, you're able to achieve tremendous neural adaptation. And we all know exercise science 101. Neural changes precede morphological. People get stronger and more powerful when they learn how to stream content. We want to increase the resolution of those neural synaptic connections. We want to get things firing. We want to wire it. We want to seal it. And this is how we would do it. So when we're doing like a side plank, now we also have to control rotation, because if we do a plank roll, the tendency on most people is to uncouple between hips and shoulders. And we want to make sure that they avoid this sort of uncoupling and that they learn to roll instead of twist. So again, Spine Stability 101, Professor McGill, just fun.